So let me switch gears a little bit and give you, tell a little bit about the work that we're doing here at the University of Maryland, as well as what's happening, because it's happening all across the country now. 25 years ago, I really realized that I didn't have all the answers that I was looking for my patients. I trained here at the Department of Family Medicine, did my internship and residency, great for acute care, worked in the Shock Trauma Center, but when it came to a lot of the chronic diseases and when it came to thinking about preventing problems, I didn't have a lot of answers for my patients. And it felt like we were a little bit like that Leaning Tower of Pisa. We were very strong on the physical side, but when it came to the emotional, the mental, and the spiritual aspects of what was going on with people, we really weren't addressing that, and we would intervene with our surgery and our drugs. And so eventually I started to look into other approaches. It took us over to the UK, to England, where there's a sort of an unbroken tradition of looking at these therapies and incorporating into practice, and was able to bring things like homeopathy, osteopathic medicine. We had a small holistic integrated practice in London, and yet my colleagues looked at me like, why aren't you coming back into the fold, that whole feeling of ostracism. So I approached one of my patients, Samaras Lang, back in the early 90s and talked to him about this, and he said, well, why don't you come up with a plan to bring it into the mainstream? And we did. We came back to the University of Maryland. He thought this was important because of Sir James Watt, who was president of the Royal Society of Medicine, and was a colleague and friend of his who said this field will never be taken seriously unless there's a strong evidence base to support it. And so we came along saying we'd like to bring an evidence base. The University of Maryland said, we don't really know what you've been doing for these past 10, 15 years, but if you're willing to travel down this road together and study some of these therapy in a scientifically rigorous way, let's get started. And so we did, and we haven't looked back since then. And this is sort of the mission of our center, and it's really an emphasizing approach that values mind, body, spirit, evaluating the scientific foundation, the efficacy, and also exploring how to bring the two cultures together. How do we really bring integrative approaches together and help people maintain optimal health and well-being, and also to educate the health professions and the public in what we're doing. And so this is sort of a snapshot in the four areas in our center, with the aim of, in a way, just expanding the view to medicine. How do we transform healthcare? And we realized that we needed all roads leading to Rome, but we needed to go in all four ways in order to begin to make this happen. And so, in part, the research where we focused on pain. It's the most common reason that people come to complementary medicine. We focused in that area, particularly in traditional Chinese medicine and mind-body approaches, and now with Chris D'Adamo joining our center, nutrition and lifestyle medicine. We also have educational endeavors. Delia Caramonti is leading our efforts there, where we have throughout the 4 years of the medical school curriculum, as well as residents, fellows coming through. The nurses are now with Bonnie, with Donna, getting training in how to bring some of these approaches to the bedside, and a real shifting of the culture of this time is starting to occur. Patient care, these are some of the therapies that we have been using both in our clinic out here, and you'll see a little bit into the Shock Trauma Center, Cancer Center, and then the informatics. How do we bring in good information for people to make decisions for their health care? So this is our faculty. We have some other visiting faculty. I won't go through everybody's background, but it's an eclectic group. It's not all family medicine. There's some primary care. There's some epidemiologists, some basic scientists, and a mixture of people.